pausing the video and breaking it up into smaller chunks because last time I had issues uploading them. But this is the second part of the video on antipsychotic medication. So we were talking about first generation or typical antipsychotics. We're talking about the side effects, which include EPSEs, and we're also going to talk about some other side effects that this group have. So it increases your prolactin. That means that you have lots of sexual side effects, sexual dysfunction. You can also get gynecomastia, and I think you can get, what am I trying to say, when you produce milk, I've lost the word, but I'm not sure if you get that men, I think you probably do as well. So prolactin going up is a really big problem, partly really because of the sexual side effects. Also, patients don't often volunteer that as a side effect for a reason why they might be non-compliant with their antipsychotic medication. So you can end up with someone not taking their medication, they might be too embarrassed to say, so it's really important to ask about it. And these are all really classic written exam questions: prolactin and EPSEs as side effects for first generation or typical antipsychotics. Other side effects that you can get that's really serious is NMS. That's really serious, very rare syndrome where the body responds essentially to a medication that's used for a psychiatric need, what we call psychotropic medications. You can actually get it with pretty much any medication that affects the brain and neurotransmitters, but it's really important you know about that. That's neuroleptic malignant syndrome. Google it. Classic exam question is asking the difference between serotonin syndrome and neuroleptic malignant syndrome. I'm not going to go into that now, but do a quick Google. There's a very quick table you can learn comparing the two, looking at tone, going up in one and down in another, various things like that, but please just look at them. Both serotonin syndrome and neuroleptic malignant syndrome can be very, very rare but potentially fatal side effects of any what we call psychotropic medication. That's medication that affects the brain or used for a mental health need. But NMS, neuroleptic malignant syndrome, is much more common than serotonin syndrome in antipsychotics. And it is, I think, slightly more common in first generation rather than second generation antipsychotic medications.